And she's an author and activist, and we have Dr. Taguchi on the phone, renowned oncologist. So ladies, let's pick up where we left off from last week. You were going to say, Dr. Dyson.
So I wanted to just bring clarity to one thing that Sharrarne was asking, and that is the use of hormone replacement therapy after a patient has been diagnosed with breast cancer.
Thank you. Yeah.
So one of the reasons that they might want to be on it, and I've of course heard you speak before, Julie, and that is the quality of life is so poor after they've been treated for breast cancer with chemotherapy. Mm-hmm. They have, horrific menopausal symptoms, and they may opt to be on the hormone replacement therapy based on that, just because they want to relieve that. But I also have seen some studies, although they were small, that showed treating women with breast cancer after they've been treated.
Treating women with
hormone replacement therapy after breast cancer,
mm-hmm.
that there was no actual, they had actually less recurrence of disease. I don't know if you've seen those studies. They were very small, and I think you've had some experiences of that as well in your practice. So
you mean
that was a very long question.
Less recurrence of the disease coming back, of breast cancer coming back, or any other disease, I think.
Well, less recurrence of breast cancer.
Okay, all right. And so you've had that.
Has that been your experience, Julie?
But what I can tell you is, I definitely have a population of women. And it's a very different population of several different diagnoses and stages. But I did put on the Wiley protocol after their diagnosis of breast cancer because they were so miserable after their treatment that they said they would rather why live when they felt like zombies or they were so awful. So I put them on the Wiley protocol, and what I can tell you after 15 plus years is that we did not have any increased risks of deaths or problems, and I think definitely improved quality of life for a lot of these women, and possibly even better results in some of the the earlier stage breast cancers. So I can say that now. I haven't published this data, and I need to do that.
And give us for those laypersons, spell Wiley protocol.
Wiley,
W-I-L-E-Y protocol. So if they need to go to their doctors or come to Dr. Dyson or you, Dr. Taguchi, they know what to ask for. And that is the same as the bioidentical. That is not the same as the bioidentical hormones, or it is.
We'll go into that.
No.
Okay. Yeah. All right.
Yeah, you can explain that later.
Yeah.
And the other thing I should make sure you understand too, that the population understands, breast cancer is not one disease. It's many different diseases, and there's different risk factors for it. There's different treatments for it. And I think the most important one that we should talk about, there's an estrogen receptor positive or estrogen receptor negative. And I think the most interesting piece that we don't know, even a lot of physicians don't understand yet, is that within the estrogen receptor positive breast cancer group, really only about 45% of those estrogen receptor positive cancers have estrogen as a driver.
Okay.
So what I mean by that is that it's maybe that particular cancer is stimulated by breast estrogen. That breast cancer stimulates breast cancer growth. That means 55% is driven or stimulated by something else.
Okay. Could be the environment, food. It could be a number of things.
Could it also be the lack of melatonin, insulin. Dr. Taguchi, in those patients?
It could be many things, and we don't know the answer to that.
I heard sugar.
Right.
That's a big, insulin. Yeah. That's a big driver of cancer, right?
Right.
Okay.
So that's where the diet or the nutrition and exercise might be important.
Yeah.
There's so many factors,
Dr. Taguchi, so if I'm understanding you correctly, I have a 75-year-old friend who has been free of breast cancer for 5 years. She was on the chemo pill for 5 years as well. So should I suggest to her that she go on the Wiley protocol? Or would hormones be good for her, bioidentical hormones?
This is the thing that's important. I think hormone replacement is not for everybody. That's number one. Now, if she's suffering with a lot of problems with the hot flashes, menopausal symptoms, and depression, etc. then hormone replacement may be good for her, with the caveat that with the caveat that the hormones may stimulate cancer that might be there.
Okay.
And if she has cancer that's still present in her body, it may or may not stimulate it, number one. But two, if the cancer's there, it's always been there. It never left.
Wow.
Okay. Well, supposedly she's cancer-free, but
With the chemo pills, you're
with
saying?
the chemo that she's taking, yeah, she's been off of the chemo pills for a while now.
Okay.
But she does have a lot of issues.
It's not cancer-free. It's that we can't detect it.
Okay, so it's not. So cancer-free is not. That's not something that happens. You don't become cancer-free. You just can't detect it in the body. At some point.
That's correct. And as a matter of fact, we use. Hopefully, you have a long disease-free survival. We don't use the word cure anymore.
No, the word cure is not used anymore because the cancer is still there? It never goes away. It can be. Okay.
Yeah.
Mm-hmm.
So one last question from me. How effective are the current treatments that we use in the U.S. in eradicating breast cancer?
It depends on what we're talking about, what type of breast cancer, what stage we're talking about it. So it's different for all of those subsets.
Right. So how well are we doing?
I would tell you for triple-negative breast cancer, for HER2-positive breast cancers, I think we're doing much better than we have in the last, 20 years.
Okay.
So we've made some progress on that. The estrogen receptor-positive breast cancers haven't really changed. We've done a better job with managing the metastatic setting over the last several years for the estrogen receptor-positive cancers.
Okay. So how long the cancer-free, what do we call it, state? Disease-free state. Are we doing any better in prolonging the disease-free state with chemotherapy than we have in the past for the different types of breast cancer? Are we doing any better?
The answer is yes for certain subtypes, yeah.
Oh, it depends on the cancer.
Mm-hmm.
Yeah.
Okay. But in terms of taking the hormone replacement therapy that you and Dr. Dyson promote, that sounds like a better option or alternative to chemotherapy? Or is it in addition to the chemotherapy? Are you suggesting that women do the therapy in lieu of the chemotherapy, in lieu of the chemo, because the chemo just devastates their body?
Okay, I can't say that at all,
Okay.
because I don't have the data to promote to show that. We just don't have that. But I think when I use the hormone replacement program with particularly the Wiley protocol, because we have to tell you, we know that high estrogen levels will kill cancer cells. We know that high progesterone levels will kill cancer cells as well, but in a rhythm. So this is what the Wiley protocol is. So I can't tell you. I would love to say that there was an alternative to chemotherapy.
You're saying that you can't say that. Can you say that, Dr. Dyson?
She's an expert.
Okay.
Okay, so I want to know, what would you do, and I'm going to ask you a personal question. If you were diagnosed, would you do the Wiley protocol, or does it depend on the type of cancer, or?
That's a good question. Yeah, what would you do, Dr. Taguchi?
I've been on the Wiley protocol. Okay, I'm 60 years old, and I do the Wiley protocol. I've done it since I was 40. I'm 20 years on it now. So,
wow.
I will have to tell you, if I get breast cancer, it's kind of the thing. Like, okay, I would have to accept that's what happens, and would I still continue it? Possibly. I have to say, but I am my own experiment.
You sound like Dr. Dyson. She says that all the time. I try on myself all the time. But this is a good time. Go ahead, Brenda.
I was just going to say, would you take the chemo?
I think if I had a triple-negative breast cancer, yeah, I would.
Okay, if that's the only time you would take the chemos, if you had triple negative. But what about if you had estrogen receptive positive or negative breast cancer, or the other kinds of breast cancers? Would you take chemo?
I would have to struggle with that one, depending on the situation. Yeah, because even within the estrogen receptor positive cancers, there's other subtle details. that might make one more prone to cancer for chemo or not. We do these certain tests called the Oncotype DX. If the Oncotype DX is really high, then that means that particular cancer might be more prone to treatment with chemotherapy. So,
when you say we do that, are you talking about in Western medicine?
yes,
Okay.
correct standard of care.
Okay.
Okay, well, this is the time that I don't know how much time do we have left? Yeah, we only have 1 minute before we go to break, Dr. Taguchi, and I know you said you have to leave, but this is the perfect time to explain the difference between the Wiley protocol and the bioidentical hormone replacement therapy. So we're going to have to do that on the other side of the break. You can do that, right, Dr. Dyson? Go ahead. She can, yes. Dr. Taguchi. Are you going to be here, Dr. Taguchi, or you still have to leave?
I still have to leave.
Oh, gosh. Oh, my gosh. We're going to have you back on the show.
Well, thanks again for joining us. I really appreciate it.
Such great
much information.
Yeah, great information, Dr. Taguchi.
Leaving me wanting more.
Yeah. We're going to take a break right now, folks. We will be right back here on Skin Deep on SiriusXM Channel 141. Thanks again.
Thank you.
Okay, can you get her back? Dr. Taguchi, thank you so
Get
much.
ready for skincare and makeup that will heal your mind, body, and soul.
Yeah,
Skin Deep
and,
Beauty is a
we'll talk
totally
to
organic
Dr.
and
Dyson
vegan
in the future about
skincare and
having
makeup
you on again.
line
This is great
that you'll
information for our
love
audience. Most of
using
my listeners are
because
women.
what you put on your body
Good
is
information.
just as important as what you put in it. Choose from our organic
We're going to get it
moisturizers,
out there.
anti-aging